First thing we need to say about the malaria situation is it turns out it's a lot worse than we previously realised. The Institute for Health Metrics and Evaluation in Seattle has published a paper in today's Lancet that suggests that previous figures produced by the World Health Organization were maybe as much as 50% away from the real number of deaths. The World Health Organization has estimated 650,000 a year. This study suggests, using new modelling techniques, that it may be more like 1.2 million a year. So what we're seeing is a vastly worse situation with malaria deaths than we realised, and also that probably as much as 2/5 of those who are dying are adults and older children, whereas before we thought about 2/3 of the deaths were actually amongst children under 5. So it's affecting the whole population far more significantly than we had realised in many parts of the world. The second thing to say is that there is a glimmer of hope in all of this, because both these new figures published today and the World Health Organization's suggest that actually those deaths have been going down over the last 10 years. And the reason for the reduction in deaths has been very straightforward. The supply of bed nets to particularly children and women in poor areas where malaria is endemic, the provision of effective treatments, good diagnostics, good health education programs, all of these have actually contributed to maybe as much as a 30% reduction in deaths over the last 5 to 6 years. So we know that there are things that can be done to actually turn back the tide of malaria. The third point, sadly, is that although there is hope, that could actually be extinguished very quickly. 40% of the funding for all of these programs that have been so effective has come from the Global Fund for HIV, TB and Malaria. The very same fund whose programs have been cut back drastically. It's not doing any new projects this year because, particularly from the European Union, the number of donor countries that are not honouring their pledges to support the Global Fund has gone up. The Global Fund is so short of funds for any new projects that it's had to stop purely to be able to carry on funding what it's already committed to. As a consequence, we could see this progress in reducing the number of deaths from malaria stop or even possibly go into reverse. So it's vitally important that we continue to keep up pressure on our parliamentarians by writing to them about this issue, that we continue to pray actively for this situation, and to keep up to date with what's going on. And you can do this by reading my blog about this issue on the CMF website.